Hi, I'm Sunil Solomon, and I'm here to talk about how we can all live a safe Zindagi. In the previous episode, we talked about what U is equal to you really means. In this episode, we're going to talk about what U is equal to you means for you, either a person living with HIV or you as a partner of someone living with HIV. So let's start first with what does U is equal to you mean for someone living with HIV. So many times people living with HIV have like this internalized stigma and they feel like, oh, I have HIV, I'm sick, I may transmit this to somebody else. But we have all this evidence from all these trials that I presented in the previous episode, which basically says that if you have HIV, you're on antiretroviral therapy, which is the medicines to take to manage HIV disease, and you take them correctly, the amount of virus in your blood really is so low that you can't transmit. So you really don't have to fear that you're going to transmit HIV to someone else. So you really essentially are someone like anybody else in the world. So stop thinking about being sick or being someone who's contagious or someone who's not wanted by society. But at the same time, I want to make it clear that U is equal to you does not mean go out and start having sex with everybody or start sharing needles or stop using condoms with everybody else. So that's not what U is equal to you means, because you still are at risk for hepatitis B or hepatitis C or sexually transmitted infections or getting pregnant. So now let's move to what does U is equal to you mean for you if you're a partner of someone living with HIV. So all that evidence from clinical trials clearly show that as long as that index partner, the person who is infected, is taking their medicines correctly and has low levels of virus, the risk of transmission is really zero. So as a partner of someone living, you really have to focus on providing them with that support, the counseling, and whatever is needed to get that index partner to really keep taking his medicines to make sure that his levels of virus in the blood are really so low that he can't transmit to anyone else. So in this episode, we talked about what U is equal to you means for you, a person living with HIV, or you as a partner of someone living with HIV. But in the next episode, we're going to switch tracks and talk to what U is equal to you means to you as a provider who's providing care to people living with HIV, and what do you actually tell your patients about what U is equal to you means and how do they actually build it into their lives. Until then, have a safe Zindagi.